This week, gubernatorial contender Amy Klobuchar rolled out a detailed health policy platform, and Minnesota is second in a new ranking of U.S. states for healthcare quality. Welcome to the July 31st edition of Healthline, the weekly news podcast from the Minnesota Hospital Association. I'm Tim Nelson.
And I'm Abby Mochtig.
This week, Minnesota U.S. Senator Amy Klobuchar rolled out her plans to address health care in Minnesota as she campaigns to succeed DFLer Tim Walz as governor next year. Klobuchar spoke at length about hospitals, and particularly hospitals outside the Twin Cities.
Our plan is to upgrade aging medical facilities and infrastructure, protect and strengthen the 340B discount program that keeps rural and safety net hospitals open, expand telehealth, which is really a mounting way to deliver health care in rural hospitals. So yes, you'll have primary care and other providers, but for specialties, having good equipment so that we could do telehealth and make sure that they get reimbursed for using those kinds of services is very important. And provide stable funding for rural emergency medical services, including for rapid response emergency vehicles, so help comes fast no matter your zip code.
Klobuchar spoke at St. Paul Corner Drug, owned by pharmacist John Hessian, who has been a regular at the Capitol, pleading to lawmakers for changes that would help sustain independent pharmacies. Klobuchar promised pharmacy benefit manager reform, as well as a plan to expand education for medical careers, to reduce paperwork for licensing medical professionals, and a program that would establish 10,000 new career development apprenticeships, including for health care. Klobuchar also said she would consider state money to replace expired Affordable Care Act subsidies, although she expects the next Congress may restore the subsidies as soon as next year. State officials said last month that 17,000 people have dropped coverage in Minnesota since the subsidies lapsed in January. The New York Times also reported this week that some hospitals across the U.S. are reporting as much as a 20% spike in uninsured patients seeking care. By the way, you can hear Klobuchar's health policy remarks in their entirety in our other weekly podcast, Hospital Matters.
Also this week, Representative Angie Craig and Lieutenant Governor Peggy Flanagan narrowed in on some of their priorities around health care, especially on affordability. The two officials are running to replace retiring Senator Tina Smith and joined a debate hosted by NPR News ahead of the August 11th primary. Both Craig and Flanagan spoke about the importance of reversing the Republican cuts to Medicaid implemented in President Donald Trump's One Big Beautiful Bill, calling on their personal experiences with the government program. Their views diverged, however, on how best to keep healthcare affordable for Americans. Flanagan backed a single-payer, government-run model for healthcare, known as Medicare for All. The effort, which seeks to replace the nation's patchwork of private insurers and Medicaid and Medicare with one government-run program, has seen a recent resurgence among progressives.
But I also believe that folks are ready for Medicare for All. We need to ensure that we're not just paying for health insurance, but that people receive actual health care.
Craig stopped short of endorsing Medicare for All, instead opting to promote a public option healthcare plan, or Medicare for all who want it. Under this model, Americans could purchase a healthcare plan offered by the federal government that would compete with private insurers. Craig said this direct competition is what's needed to hold down healthcare costs.
One of the reasons why I am concerned about moving forward with Medicare for All would be that we live in a healthcare system today that rewards volume. Physicians get paid on the number of procedures they perform. Hospitals get paid on the number of procedures they perform. It actually rewards disease in this country. We have to move to an outcomes-based, values-based system where our healthcare system is based on actually achieving health.
The winner of the August 11th DFL primary will face the winner of the Republican primary race in the November general election.
Also this week, the Minnesota Department of Health's Center for Healthcare Affordability held a joint meeting with its Payer-Provider Task Force and its Healthcare Affordability Task Force. They opened the meeting with significant discussion about the impact of last year's H.R. 1 in Minnesota, and in particular what Medicaid disenrollments might mean for hospitals starting next year. But most of the discussion focused on affordability for employer-based and other private insurance, without addressing the significant cross-subsidy that private coverage already pays to backfill underpayment by taxpayer-sponsored coverage. The MDH panels are expected to make recommendations to the 2027 legislature about healthcare costs and affordability and could play a key role in healthcare policy starting next year. And more MDH news of note. The Star Tribune reported this week that emergency department visits in some parts of northern Minnesota saw a 28% spike in patients reporting respiratory problems during the peak of wildfires in the area earlier this month. The Star Tribune cited a new Minnesota Department of Health tool that monitors electronic health record coding at most hospitals in the state. The same tool also looks for heat-related illness in real time. Some hospitals, however, actually reported a drop in patients as visitors and some residents left the area because of the fires, and because many people in the area heeded advice to avoid exposure to the smoke and took precautions like wearing N95 respirators. And finally, some good news this week. A new ranking by the finance web service Wallet Hub says Minnesota ranks second in the nation for quality health care. New Hampshire topped the list, and Iowa rounded out the top three. Wallet Hub analysts looked at 44 indicators that examined cost, patient access, and health outcomes. They ranked Minnesota number 3 for cost and number 2 for access among the states. And that's it this week for Healthline, the weekly news podcast from the Minnesota Hospital Association. I'm Tim Nelson.
And I'm Abby Mocktig.
Thanks for listening.